good day, everybody. Welcome to My Life Without Limits podcast. It is Leah again. Again, we are without Carlos. We are wishing him well, though. Good progress is being made in his life and everything is all okay. But we have Emily with us again. Emily, how are you?
Good. I'm so happy to be back. Thanks for having me.
No, it's great to have you back. And you've stuck around a little longer. We still got you. Not letting go. So glad to have you here. Everything's been going good with you in your busy life that you have.
Yeah, everything's great. I'm really enjoying my job here at CP Alberta. I'm kind of just doing all the things, doing all the
Mhm.
recreation things, extracurriculars, sports, all that good stuff. And I'm excited about Inclusive Recreation Day coming up on June 19th. So
Yes,
everyone should mark their calendars for that for sure.
that's right. Don't want to forget about that. We're looking forward to celebrating that. But today we have a new friend to introduce you to. His name is Sam, and we're so glad to have him here. He's calling in from London, all the way overseas. So we're happy that you've made the time for this. So why don't we just dive right in and just learn more about you, Sam, and
Cool, cool,
go
cool.
right
Well,
ahead.
it's t totally my pleasure to be here. Thanks so much for letting me have the chance to chat with you both. So I'm Sam. I'm a co-founder at an organization based in London called Hibi, Hibi.
Mhm.
And we built an app to support families raising children with developmental differences, health conditions. We're really trying to be a kind of caregiving companion to support with the care management of information from medications, appointments, symptoms, to support with that, but also provide access to information, expert guidance, help to navigate what can be a really overwhelming system and situation in some instances. And so I was lucky enough to be connected with you both through some of the work we're doing to spread awareness of Hebe.
Mhm.
And here we are today. So thanks so much for letting me join you.
Yeah, no, I'm glad to have you here. And it's funny because last week I got forwarded an email from my manager, Cindy, who works out of our Calgary office. And she's like, oh, take a look at this. And I was like, actually, I've already spoken with him and he's on the podcast next week. And she was like, oh my God. So I was like, yep, we are making moves. We don't sit around.
Yeah, I'm
Get things
coming at you guys
going.
from all angles.
Yep, that's right. No, that's good though. It's very good. So yeah, the app sounds great. So how did you get involved with it? How did you come up with this idea?
So I professionally have spent my career in the UK working in the world of healthcare, not in any clinical capacity, but in kind of management roles. So I started working with the National Health Service here in management roles for a few years, and then I worked with a big international healthcare organization. But the reason I wanted to work on Hebe specifically and support with what we do comes from more of a personal angle. So I grew up with my mum working as an occupational therapist for individuals with epilepsy and learning disabilities, and saw through the lens of her work some of the needs in that space. But separately to that, I also grew up with a very close family friend with quite complicated cerebral palsy, and saw what that meant for his family, and also gave an insight into how complex navigating care systems can be, regardless of where in the world you are. And so, because of those experiences growing up, when I moved to London, because I grew up in the middle of the countryside, when I moved to London, where I'm calling you from now, I started volunteering at the weekends for a charity here in London called Keen, which supports children with developmental differences at the weekends. And that was with a children with all sorts of diagnoses or not diagnoses. Most often it was autistic children, children with ADHD, but also children with cerebral palsy, Down syndrome. And what I realized is that every child, very, very different, but for their families, who I got to know fairly well through this volunteering work, there were some shared needs, which is that all of those families, the parents become their child's care coordinator, and they have a huge influence on their child's life, as any parent does. But from a medical lens, from a healthcare lens, from an education, social care lens, there's some nuances for those children in these situations. And so, what I wanted to try and build was something that would support them, support their children, to help navigate the system, to help manage the care information, and and in the round really empower families to coordinate care, because there's a lot of fantastic research done to show that where you can support care coordination, where you can support families, care outcomes improve massively.
Yeah.
And also the healthcare system runs a bit more efficiently because information is shared when it needs to be shared in the right way. And that's the premise behind Hebe, really, is to try and make sure that every family caring for a child has the support that they need.
I love the term care coordinator. I think that sounds, I don't know, because that's what you're doing, really. Because, you know, as a caregiver, I mean, you're caring, but you're also coordinating a lot. And I know a lot of I have some friends, you know, with kids who have CP, and the binders that they have
Yeah.
of like papers. And like for me, as someone ADHD, I cannot be organized for like to save my life. I couldn't organize. So I think something like that would be more helpful
Yeah,
than.
we would often hear just from like before even I can conceptualize TV, I'd often hear about how if a family were in a hurry to drive up to a hospital, they'd need to make sure that they kind of got the filing cabinet out before they jumped in the car, these sorts of
Yeah.
things. And
Yes.
what we want to try and help with Hebe is make sure that that key information, um, whenever you need it, is in your pocket and on you, which in the format of kind of a mobile phone is usually how most people
Yeah.
are looking for these things. So we initially started with this app, and it's been amazing to hear from kind of strangers around the world who one person wrote in a few days ago saying, Hebe, I was in a situation where the paramedics were called out, and actually I could just quickly open up and export the key information when they asked for a list of medications or medical history, these sorts of things. So yeah, glad that we're helping people and also taking some of the weight out of the big ring binders that still do the rounds.
Yeah.
Absolutely. And some of the terminology and yeah, names of medication, even for like my own, when I go to somewhere and they ask, I can't even remember what it's called half the time. So it's like, yeah, I could probably use that for myself. Yeah, to remember all of that. Because you can download a PDF of everything, right? And just send that off to a doctor if needed.
Yeah, that's right. So the easiest way to kind of describe what we do through the app is kind of in three chunks, three features, but they're all quite flexible to your needs. So we're talking right now about the first feature, which is what we call a care passport. In
Mm-hmm.
the UK, that's a phrase that's used quite often. It is something that provides a relatively high level overview of an individual's needs, and who they are, what they like, what they dislike. And so today in the UK, the NHS will often ask a family to print out a paper version that they fill in by hand. And that will usually include kind of a list of the medications. It'll include a snapshot of the medical history, their key contact details, key information around what happens if there's a seizure or what equipment they use. It really depends on the child. But the issue that we'd often hear from families is that they don't have this on them at the right point in time. And if they do, maybe they filled it in once, they handed it over, and then they'd have to fill it in again, and they don't keep it up to date. So the idea with this first feature in Hebe is that if you download the app, you fill this in once, you can keep it up to date as you like, and then whenever you need it, it's on you to be able to export it. You can export it as a PDF for somebody to receive via email, WhatsApp, AirDrop, whatever it might be, but you can also print it off yourself and
Yeah.
make multiple copies of it, whatever suits you.
Yeah. That's
Awesome.
clever. That's very clever. Emily, could your parents have used something like this when you were
Yeah,
growing up?
absolutely.
How did they handle everything?
Yeah, they had the three ring binder for
Mhm.
sure. My mom had pocketbooks and papers and yeah, stacks of folders in a filing cabinet. Um, and even myself, now I'm managing my own care. I've been managing my own care since I've been 18. And I work with anywhere from like 5 to 10 professionals in different industries. I see a neurophysiotherapist, I see a cerebral palsy specialist, I see a family doctor, I see a massage therapist, I see an occupational therapist. So
Mhm.
having something like this where I can when I meet a new care professional, or something happens in my life where I have to kind of transmit the information to everyone, that would be really helpful. Yeah, I can definitely see myself using it.
It's really helpful to hear that, Emily, because we to your point on how care continues. So that first thing that I
Mm.
described was this care passport, which is it's kind of a static overview or it's a snapshot at that point in time. But a lot of the time, the families that we work with, that where the ring binders come into play is because you're continually collecting information that you need to keep track of. And so that's the kind of second feature of the app. We call it the journal, but
Yeah.
basically what that allows you to do is to continuously keep track of all the important information you might need to. So, for example, your pediatrician might have asked you to keep a seizure diary, or might have asked you to keep a track of exercises to do at home or symptoms or whatever that might be. You can store and track those all within the Hebe app and view trends. You can keep records of kind of medications and when they were taken. You can also kind of make notes of appointments and upload the documents that accompanied them. So it's all in one kind of 21st century style of information management, and you can sync it with your calendar and these sorts of things so that it's easily able to be searched through, and you can draw insights from it and more. And the reason I say that is because what we're working with a few hospitals in the UK and families in the UK on is actually making it so that as and when the child is old enough and able to use Hebe to actually own that and have that support the transition of care. We've
Yeah.
initially started on parents who have children who are quite young, too young to be using mobile phones typically. But we're working on trying to support this transition of care and the information sharing that comes to that. So yeah, it's quite exciting for us.
Yeah, absolutely. When I was using the app, I have to say the UX, the UI, they were fantastic. Like I
I'm glad
really,
to hear it.
yeah, the kind of like user journey was very simple, very straightforward. And I think yeah, I think it can really be beneficial to parents like navigating big changes in a child's life. Like in my adulthood, I changed from wearing a ankle foot orthotic, like a brace on my left leg, to using an electrical stimulation device. And that transition was so many appointments, so much information needing to be passed between care professionals. And I think something like that a parent could really use to
Mhm.
help communicate between different doctors' offices, different physiotherapists or OTs, stuff like that. I
I'm
really see
really glad to hear that.
I really, really do see a benefit to this.
Yeah, I'm really glad that that resonates because that's exactly why we wanted to try and build something like this to make sure that families and individuals can actually focus on the care itself or whatever else is going on rather than necessarily all the information sharing and the admin that comes with it. And we often hear from families who are kind of inundated with the forms that you have to fill in for whatever it might be, insurance or benefits or otherwise. And hopefully that's something Hebe can help with as well because we're keeping track of it all in one place. And I'm going to pass on your kind comments about the design to the team because they're proud of that. We wanted to make
Yeah.
sure that when we built Hebe, it was something that felt like it was nice to use because I think a lot of
Mhm.
things in healthcare and maybe a lot of kind of patient experiences can sometimes feel a little bit outdated, a bit clunky,
Mhm.
and maybe there hasn't been the same kind of attention to user experience as other
Yeah.
areas of technology. And so we've really tried to make it something that's intuitive and clean and easy to use, but also quite nice to use as well. And we're always looking to improve. Like Hebe will never be a finished product, and I'm sure there'll be things that you could find today in the app where you go, "That's clunky" or "That doesn't look great." But we want to keep trying to make it a really intuitive thing to use.
Yeah. And then you and I touched a little bit when we first spoke about how a lot of our families that have kids with CP, they keep Instagram accounts. And that's how they track progress, is because they will show, like, here's my kiddo doing this, and then here's, so it's a good way. It's good for family and friends that are invested too to see progress, but it's also for the parents themselves to be able to look back and go, oh yeah, look how much better, she's walking this in this video than back in that one. And um, do you think that that kind of provides the same, like Hebe will do the same sort of thing where you can sort of, with the journal especially, kind of look
Yeah,
back and be able to say, oh wow, like what a difference.
yeah, hopefully. And we've tried to design it in a way that the tools themselves are kind of flexible to whatever the needs are. So that you certainly can do that within Hebe. You can upload pictures and videos. And actually, one of the things I didn't mention is you can invite other people to the app. So totally at the discretion of the family, you can invite your partner or even a care professional who can collaborate with you on the app, so that that care record or equivalent of an Instagram feed, actually you can have different people uploading different updates, documents, pictures and images and so on. But one of the other things we don't want to do is kind of reinvent what's already out there. So
Yeah.
we're very cognizant of like trying to build something that is providing value, but isn't just like kind of replicating something that might already be out there. So hopefully it can be used in those instances, but we want to work alongside all sorts of tools that are great. And I say that partly with regards to, the power of certain Facebook groups, for example. There's some amazing communities out
Right.
there. And I think we want to make sure we kind of fit in quite nicely rather than reinventing the wheel or kind of becoming a bit redundant.
Yeah, no, absolutely. And I think you're doing a good job with that so far, it seems. So what kind of team are you working with? Like, who have you got, behind you on this?
So I'm really lucky to have an amazing team. Calling you from this strange orange office that we were joking about earlier.
I like
We're
it.
just
I don't know.
just a small team. So we're a team of four working full time. We have at various times expanded up and down depending on what we need at one point in time. So we have an amazing designer, for example, who we worked with in the early days on a contracting basis, who I'm going to pass your kind words on to Emily. And then as and when we need him, we go to him. As and when we need a bit of support on marketing or clinical advice, we expand up and down. But at the core of the team, there's four of us. So I co-founded Hebe with a brilliant software engineer called Uzai. And we met, I don't know if I told you this, Leah, but we met in this kind of slightly bizarre circumstance where I had been thinking about building something like Hebe for some time, but I'm not a technical person by training, and was very keen to meet somebody with a technical understanding, because one of the things that I'm very kind of emphatic about at Hebe is that we are doing absolutely right when it comes to data security, data privacy, understanding that we are on top of and beyond what's required. And for me, that meant somebody on the co-founding team needed to be technical. And the way in which I found Uzai was through this program here in London called Entrepreneur First, which is a way of meeting co-founders and trying to launch something off the ground. But the best way to describe it is a kind of combination. And I don't know if these TV shows would have made it over to Canada, but they're quite good, so they might have. It's a combination of Love Island meets The Apprentice. So it's like this
Okay, yeah.
business. It's like this business orientated environment where everyone wants to start an organization, start a business, or start a startup. But the way in which they do it is that you kind of have to date for a co-founder, and so half of you, like 50 of you, are not technical, but you've maybe got an idea or a bit of industry experience, and 50% of you are technical. So you're kind of looking to pair up with each other and find a match. And this accelerator called Entrepreneur First, they won't back you, which is to say they won't get you through to the next phase of the program unless you're in a co-founding relationship. So they have a kind of hypothesis, which is grounded in statistics, to be fair, that those organizations that are founded with a team of two are more likely to succeed than solo founders, just because of the difficulties of setting something up. So they need you to find somebody, but it inevitably means that everyone's kind of running around to try and pair up and go behind each other's backs for it. And luckily, I managed to convince Uzai to work on this idea with me. And so we started that at the very end of 2022. And then we were able to bring on our lead engineer, a brilliant guy called Kush, who was on Entrepreneur First with us, and we knew from before. So Uzai and Kush have been working hard on building the technology. And then we have a brilliant colleague of ours called Mel Dimmitt, who lives in Australia. And she wrote a fantastic book called Special about experiences of raising her son, Arlo. And she leads on our content and community. And so between the four of us, with some external kind of third party support here and there, that's what's been bringing Hebe to life so far.
Well, that's very cool. Well, and it's funny because like doing social media and stuff, I'm always looking for great stories to share, mostly Canadian based, because that's what, would be relevant for our feeds. But when I'm Googling, most of the stories are from the UK, and there's always, it's like, or even Australia. And we used to be connected with, well, we are still a little bit connected with the CP Alliance there. We used to do September. we tried to make it work here in Canada. It's like a 10,000 steps a day for 28-day thing. It was kind of fun, but yeah, so many stories of cerebral palsy like come out of the UK. And so it's like when I see a product like this coming out of the UK, I trust it, to be honest, because I don't know. I just feel like why it's so prevalent there, but there's just a lot of really cool stories that come out of the UK.
I actually on that point, I'm glad that the UK has that perception and there's some amazing work being done here. But what I would shout out is Australia actually in particular, because and this is all relative, but we've certainly seen that when it comes to kind of innovation in this space, Australia punches above its weight in terms of the number of people living there and so on. And I think it's my understanding is that it's largely because of this NDIS program they have over there, where there's a lot more light shone on innovation in this field, and because of organizations like CP Alliance. But yeah, in the same way that you look at the UK, I often look at Australia and think, wow, there's some great things being done out there.
Yeah, no, I agree. And World CP Day, I mean, they're in the U or Australia as well. And that's a big thing that we do here, because I think the States always had National CP Month, and then it's starting to catch on up here in Canada where people are recognizing it a little bit more now. Had you heard of it before, Emily? Like like it was always March was like a CP awareness month.
Yeah, and then World CP Day is in October, right?
Yeah.
Yeah.
Yes. And we always recognize that because we worked with them in Australia. And yeah, the CP Awareness Month was always so US based, but now it's really starting to trickle up.
Yeah.
So
yeah, I took note of
a lot of awareness.
I took note of World CP Day like 3 years ago when I really started my own advocacy journey. I kind of like launched my like announcement that I was stepping into disability right advocacy and stuff 2 years ago. So I did that on World CP Day. And yeah, I haven't looked back since. And also I think that the movement is growing, and I think, applications and organizations like Hebe, we can really use to promote like the good work that they're doing and the good services they're offering, and kind of align them with days like World CP Day.
Yes. Yeah. Agreed. Yeah. Yeah. We've put it out there on our socials and everything, getting people interested. So right now, what kind of phase do you feel like you're in with the app right now? Like, do you have different stages that you're working towards?
Yeah, it's actually it's a good question, because we were talking earlier as a team, about how we see the phases, and they're kind of like almost chapters of a book, because there's so much that we want to do. And we talked a little bit about earlier how, Emily, you were talking about how it could be something that you could use to manage your own care. We've initially started on parents of younger children to support them managing their care. There's all these things we want to do to allow Hebe to be as useful as possible. I guess the chapters so far have been designing Hebe last year, which we did with loads of families, like hundreds of families. We went to workshops where we would literally kind of take paper printouts of mocked up app designs and be like, what does this look? And like hand out felt tips, and people would draw the things that might be helpful. I mean, even before that, we were like, what are the problems here that we might be able to help for? So we spoke to loads of families, we spoke to loads of professionals and charities and care organizations here in the UK. And then we kind of built a first version. That was maybe chapter one, then understanding if there was something that we could help with. And then chapter two has been the start of this year. We put it out there into the world to get some feedback and see if it is helping people. And fortunately, we've seen several thousand families around the world start using Hebe, which has been really rewarding and had some fantastic feedback and partnerships with organizations. And now what we want to do, now that we know that Hebe is something that is helping families, and that's not to say that it's a panacea of all the solutions, but it's helping in some capacity to solve some of these challenges. We want to spread awareness of it. And so when you were talking about these World Awareness Days and so on, they're great ways to try and help families become aware of resources that might already exist, but that they don't know exist. And part of the reason I wanted to found Hebe was because the charity that I've been working for in London for several years, we would have families turn up who'd say, "This is amazing. Like my son absolutely loves it. I've lived next door for like 5 years, and this is my first time I came. I didn't know about it." And so we're in this phase now where we really want to help people know about it. And Hebe, it's a free app. We have a version called Hebe Plus, which is a premium version that families can either pay for directly or they can have care organizations buy licenses on their behalf. But at the core, Hebe is a free app. And so we just want to help people become aware of this resource that hopefully can be supportive to them. And that's really the chapter that we're in now, is how can we, at the point that would be most helpful for families, maybe it's around the point of a diagnosis or whenever it might be, how can we help spread awareness of this? And then who knows what will come in the future. But what we're hoping is that we can then start building in some of these use cases, like a child when they become an adult using Hebe to continue coordinating their care and so on.
Yeah, I love that. And especially to have, maybe an organization or a clinic or something pay on behalf of that. That's a really cool idea. And I think that's something that nonprofits could really get into as part of their parent support services or something, is maybe if they've got funding to say that, we will, help provide this for you as part of our parent support and, just a way to help.
Exactly, and we do that in the UK here with a number of organisations who kind of partnered with us to make the Hebe Plus version freely available to families in their network, maybe post-diagnosis or whenever it may be. And what that then means is that those organisations, we haven't talked about this part of the app much, but those organisations can then upload content that they would like those families to see because they think it would be particularly relevant. So the kind of third final feature of the app, if we go from Care Passport to Journal, this third feature is the Discover section, which is really an area of the app that's full of kind of personalized content to you. And then that might be parenting strategies, it might be parent care or well-being, it might be how to use the app, but it really depends on where you are and what you've entered into the app. And it's all sort of content that can guide you and benefits and these sorts of things. So yeah, we've got this final section that when we partner with organizations, they can also personalize that depending on what they think would be most helpful for families.
Yeah, that's very clever. Well, I put you on our resources page that I have. We did an app once during the pandemic. We thought, how can we keep our community, connected to each other? And so we started like community type app where it was like a forum and there was different groups, and the idea was so huge. Then I was always like, I gotta tailor it down, gotta find the focus. But it was just, I don't know, it was a lot. So we don't have it anymore. It was fun. It was a whole new world. But then I got connected. We did it with, I can't even remember the name now, but it was a company that they did all the technical work and everything. But the community that came out of it that I was able to join of like community managers was very cool. Connections that you can make from it. And they were from all over the world. One girl I talked to, she was in Madrid, and I was always just like,
yeah, that's been one of the things that's been I've really enjoyed from this experience of launching Hebe. It's just meeting people around the world, kind of like-minded, trying to do things in this space, like yourselves and like those that we've met in Australia or all sorts of countries, lots of people in America as well. To be able to connect with people and kind of hear if what we're doing resonates, but also if it doesn't, then we learn and we can get better. So I think that's been one of the things that's quite special about working in this field, is that there's a lot of passionate and very interesting people to talk to.
Yes. Yes, there are a lot of passionate and interested people to talk to. No, you're absolutely right. And we're going to, United Cerebral Palsy, we're going to make sure that they take notice of this app too. We'll be talking to friends over there, because I think that would be a really great way to get you in. Is there anything else that you'd like to mention about the app, or do you have any questions, Emily?
Yeah, I have a question. I guess, like, what has been the biggest pain point or roadblock that your team has faced, and like how are you overcoming it? And like what kind of path forward do you see with that roadblock?
Yeah, that's a great question. I mean, I think building anything from scratch is like it's never easy. So there's definitely roadblocks there. I think one of the things is patience. Really, I feel like the Tahiti team and our advisors, we all have quite a clear idea of where we want to take Hebe, by which I mean both as a product and also as an organization. And we hear from families who are so often making brilliant feature requests of what we should do in the app. And, we all want it to be like up and running like this today. We want it to be like we want the technical resourcing of a Google or a Facebook, but we're not a Google or a Facebook. So we have to be somewhat patient about actually building the technology that we can visualize and can describe today, but takes time to build. So I think patience is one of those things. And we're getting there, which is exciting. In the space of weeks and months, we've gone from something that really didn't really exist, which is a design, and are now being used by thousands of families, which is cool. But when you're in the thick of it, you're like, okay, well, I want this next feature to be here for families because they've asked about it. So I think that patience thing and realizing it's kind of a marathon as much as it is a sprint is quite important. And I think that's true both for actually product features, but also about raising awareness of the support that we provide, because we're hearing from a lot of families who use it like, this is great, so I'm going to share it onwards. And so we're like, okay, well, if this could help families in these situations, and there are however many of these families who might find it useful, how do we get them all in front of it now? But actually building that reputation and that credibility and that trust as well takes time. And I think especially for trust, you want to make sure you're patient with it and not cutting any corners. And that's why we work very tirelessly on building partnerships with organizations and making sure that things like our data compliance and data privacy are rock solid as well. So yeah, a bit of a long-winded answer, but I think it's patience.
Yep. No, that makes sense to me. It does. It takes time, right? Just to get it out. But sometimes it's just reaching that right organization or person that can help. And hopefully we can help with that, because I do believe that it's a great platform that will be very useful.
Well, I hope so. And that, on that point as well, we're always learning. And like I think that's one of the other things that's great about speaking to organizations and people like yourselves, because every time I hear somebody use Hebe and hear, even if I hear them describe it like that they're finding a part of it's particularly useful, just learning how they describe it then helps us learn how we can convey it to the next user. So we're really keen to just constantly be hearing from organizations and professionals and families. I was mentioning earlier, we don't have the resourcing of a Google or a Facebook from a tech perspective, but what we do have that those organizations don't have is much more of a personal touch. So if you were to email us at hello@hebe.health, you're emailing me, and I'm then talking to my two colleagues next to me saying like, oh, Susie from Alberta wants this feature. Let's get it live for her. Which I think we really want to try and have as an ethos as a company throughout, be really receptive and engaged and close to our users.
Yeah. I love it. I think that's great. That's a huge deal, actually, because a lot of people think if you email that email, I mean, who knows who it's going to and if it's going to get anywhere. And no, I think that's really great. Awesome. Well, Life Without Limits is what we are all about. So, question for you, Sam. What does living life without limits mean to you? And do you feel that you live your life without limits?
Yeah, it's such a good name and such a good question. When I was thinking about it, when I kind of saw that phrase, that name, I think for me, I interpreted it as like awareness. So there's like not having limited perspectives on things, because I don't think cerebral palsy or developmental conditions are necessarily shone a light on in the same way that other areas of health or patients or society or however you want to phrase it are. So I think for me, life without limits is about just having that broad perspective and awareness of everybody's different walks of life, and learning it from there. And that's not to preach that I have that worldview to the extent that I want it to be, but I do think the experiences I've had with trying to bring Hebe to life to date have definitely helped me broaden that horizon and see life from different perspectives, and hopefully reduce some of those limitations to my experiences. I probably haven't explained that too well, but I think I interpret it as kind of open to different perspectives and being aware of just everyone's different walk of life.
Yeah. Yeah, I don't think there's a wrong answer. I've learned a lot in these last few years of asking this question. And it's very cool to see everybody's different perspective on it and realizing that it's really not us all the time putting our limits. It's not, someone's disability putting their limits on them. It's just the outside stuff, the barriers that are.
Yes. Yeah, exactly. Exactly. It's a great question.
Yeah, we love it. That's what we're all about over here, life without limits. So where can people find you, Sam, if they're looking to check the app out? I'll put it all in the show notes and everything, but why don't you let everybody know where to find you?
You can find us on our website, which is hibi.health. So HIBI.health. If you just searched Hibi Health on Google, will come up for you. You can then download the app for free, check it out from there. We're also on the app stores. So if you're on your Apple App Store or your Google Android store, you can just search for Hibi through there. And we're also on social media, particularly our Instagram. We have a great community of followers on there. We regularly produce content, including interviews with families and guides and other things. So yeah, website, app stores, Instagram, search for us and get in touch. And I really mean it when I say if anyone has any thoughts, questions, or feedbacks, we'd love to hear from you.
That's great. Anything else, Emily, at all for you on your end?
No, that's it.
No, or anything
else? We covered it all.
No, this was great. You know exactly what you're doing. I think you've got a good handle on what you're trying to make, with this app. And I don't know, I'm really excited to see how, what comes of it and to talk to more families that hopefully we can direct over to it and get them using it and just seeing, what they think.
Well, it was like totally designed by families for families last year in that design process, and it always will be designed for and by families. So yeah, I'm excited to see where it goes as well. And thank you both so much for making the time to speak to me. I kind of reached out to you guys initially just out the blue from across the pond, and I'm really glad we were able to make the conversation happen. So thanks again for your time and your thoughtful questions. I really appreciate it.
Oh, no, thank you. And thank you for making the time. I know it's a little like here, we're during our work day. I know in your line, there's every hour constantly working, but no, I appreciate it very much. It's hard to coordinate sometimes when we're so far apart, but thanks.
No, my pleasure. My pleasure.
Awesome. Well, thank you, Emily, for being here for another episode.
Yeah, thanks for having me.
And we'll have more to come. We've got other things. Every time I talk to someone, I'm always like, hey, you want to be on a podcast? And there's been times where it's like, we'll have like 5 episodes recorded and I'm like, hey, you're going to have to wait a few months for it to come out. But no, it's been great. And I'm happy to have you here again. And we've got more to come. So thank you very much, Sam, and have a good rest of your evening. And everybody listening, please remember to live your life without limits. Bye-bye.
Bye.